Great day, world. Thank you for joining me. My name is Riel. I'm publishing another episode of Dose of Rielity. The date is February 18th, 2022. And let's get right into it. I'm going to share my screen. So I published yesterday, and my videos are going to be, at first at least, reviewing the news and the chronicles of the pandemic as told to us primarily through the lens of CBC, which is the Canadian Broadcasting Corporation. I am in Winnipeg, Canada, so that's why I'm going to be using Manitoba as a case study to outline the narrative that we've been told to help us understand how we got to where we are today, where I will be doing more modern news updates in the future. But before I get to that stuff, I think that I want to focus on helping us understand the chain of events that led us to where we are that have occurred over the past 2 years. So first off, I just want to say thank you for everybody that's watching this. Thank you so much to Dave at Generation Z and the entire community that Dave has been building, and he's allowed me to join the community and become a co-host in some of the interviews that we have done. I am a behind-the-scenes researcher with Generation Z, so please check us out at Generation Z Podcast on YouTube, as well as the Patreon. On the Patreon, we can go into a lot deeper stuff because we don't have to deal with censorship. So for now, I'm just presenting my ideas on YouTube, perhaps some other channels, but for now, because of the platform that I am using, I will be deliberately not trying to get censored. So I just want to present the information in a way with some additional commentary that may or may not get a little more I may get more confident in sharing my opinions as we go on, but I am going to try to just remain as balanced as I can. So thank you very much. So yeah, thank you everybody for joining me today. So if you have seen my previous hour-long episode, I used the slides that I've put together to lay the foundation for understanding what the PCR test is. And we can just do a bit of I don't need to review it too much, but I just want to make sure that we understand how, yes, okay, so let's give a PCR test recap. So we showed that the test is not a diagnostic tool, nor can it show infectiousness. We saw that Fauci admitted that the PCR tests, anything above 35 cycle threshold is useless. We did in fact see that in the Manitoba court trial, they actually admitted that in Manitoba, the cycle threshold is actually set to 40. So I know that yesterday when I made the video, on February 17th, 2022, I couldn't find the specific piece of information, and here it is. So it says actually that Manitoba has confirmed that it utilizes cycle thresholds of up to 40 and even 45 in some cases. This was presented in a trial in court in Manitoba, a 9-day trial, and I can't wait to get into that. I think that is going to be probably in my 5th video, actually, as I'm planning, at least the 5th video in the series of the pandemic chronicles. However, I may choose to jump out of line, but we'll see. Each video is probably going to be about an hour. So, okay. So yes, just to lay the foundation for the PCR tests, cycle threshold, even as anything above 25, false positive rates become excessive. The FDA recommended tests to be calibrated at 40. Manitoba witness confirmed in court the tests do not prove infectiousness. And Brent Rusin, the public chief health officer, the main figure of the entire pandemic, testified in court that he did not mandate the cycle threshold to be calibrated and confirmed that Manitoba uses tests with a cycle threshold of 40. We also just explained what the tests were and how they are actually a molecular test. And in Canada, there is such a thing as the Genetic Non-Discrimination Act, which I will just show you right here. Genetic Non-Discrimination Act actually means that you cannot discriminate against somebody for refusing to take a molecular test. And we looked at the scientific information explaining that COVID-19 is indeed a molecular test. So just want to put that out there. And we also looked at how the emergency use authorization is how the PCR tests were allowed to be used, but they weren't the real PCR tests. They were the RT PCR tests, which was created by Christian Drosten of Germany. And he has a bit of a background in all of this. And we will look at him as a character and actor later on in my presentations, probably at about number 7. So again, thank you so much for joining me. This is Dose of Rielity. You can also find me at Generations Ed Podcast. Okay, so let's begin with today's presentation is at least going to start talking about the flu cases in Manitoba in January of 2020 and the impact that the flu was having on the healthcare system. So we're going to set the stage for the month in Manitoba leading up to the pandemic. I intend to also review what a case is and what it means to be hospitalized in the whole pandemic era. So to start, we're going to be looking at CBC articles like I promised in the previous video. Just this is my 163 slide document. This is my 340 slide document. So there's a lot of material that I will eventually be covering. And so this article we're looking at is January 4th, 2020. The headline is Surge in Illness Prompts Winnipeg Health Authority to Activate Flu Plan, and they ask staff to pick up shifts. So the Winnipeg Regional Health Authority, WRHA, official says increase in respiratory illness, including flu, driving capacity problems. And we can just see that, Winnipeg Regional Health Authority says an increase in patients in emergency, urgent care, and critical care departments has led it to activate overcapacity protocols and the regional flu plan in its hospitals. They included confirmed flu cases. January 4th, 2020, we have confirmed flu cases. And you may be asking yourself, why do I want to emphasize that they confirmed flu cases? Well, we will look at that shortly. Another thing that was very interesting in Manitoba in January 2020 is that through an internal memo sent to staff obtained by CBC News, Williams, an outgoing WRHA president and CEO Réal Cloutier said there have been confirmed cases of influenza A, influenza B, and respiratory syncytial virus at the same time. The quote is, to have all 3 viruses surge at once is unusual. Most years, each virus starts and peaks at a different time, the memo read. This is a challenging time, but all hands are on deck, and we are monitoring the situation and meeting every day to ensure we are doing what we can to provide self-care. Okay. It continues, surgeries. The next article is surgeries may have to be canceled. Patients moved elsewhere, says Winnipeg Regional Health Authority. Surgeries may be canceled. Okay, and again, this is January 2020 from the flu. The opposition leader blames the staffing woes and the government's consolidation of emergency rooms as part of its healthcare system overhaul, which he argued has overworked hospital employees and caused others to quit. Totally fair, totally legit. There's a lot of stuff that I'll be getting into later when I do a segment on the nurses and the healthcare workers, because that is absolutely an important aspect of all of this from whatever side of the table you're on throughout the entire pandemic. We even have here is the Manitoba Nurses Union President Darlene Jackson said the government, health authorities, and nurses other employers need to shoulder the responsibility of ensuring safe staffing levels during flu season. Another headline from January 8th, 2020 is with Winnipeg hospitals crammed, NDP blames dwindling number of ICU beds for patient crunch. The Winnipeg Regional Health Authority says drop is by design after new types of critical care beds opened. The drop is by design after new types of critical care beds opened, January 8th, 2020. What does that mean? So NDP leader Wab Kinew said Wednesday, a document obtained through a Freedom of Information request shows the number of available ICU beds in Winnipeg has steadily fallen from 73 beds in January 2017 to 63 beds last July. On Tuesday, the Winnipeg Regional Health Authority said it currently has only enough employees to care for patients in 58 of those 63 beds. Interesting. So January 2020, the information came out that the ICU beds at one point we had 73 in Manitoba, then they fell to 63, and we only have enough staff to cover 58 of those 63 beds. And they said that it was a deliberate drop by design. Of course, the NDP say it's simply because we have a conservative government that wants to save money and cut the healthcare system we all rely on. Fair enough. That seemed like a fair assessment. And in articles that I have in my other document, there was, yes, it is a fascinating thing to monitor the hospitals and the nurses and their long plight against the government and budget cuts and firing staff all before the pandemic. There was a lot going on before the pandemic of 2020. So continuing from that article, it says, the WHRA said the decline in the number of ICU beds, which is for critically ill patients who need consistent monitoring, is intentional. It was intentional. The health authority said there are currently 107 beds in Winnipeg for the most seriously ill patients, which includes 63 intensive care beds, that only 58, we only had enough staff to care for 58 intensive care beds. There were 113 of those beds in January 2019 and 101 in January 28. 113 of those beds in January 2019 and 101 in January 2008. So there they actually increased the intensive care beds. So that's good. Now, Winnipeg from CTV, Winnipeg struck by 3 influenza strains. Health officials left scrambling. Flu season has hit Winnipeg with 3 times the power due to multiple strains of the virus circulating at once, leaving health officials scrambling. The Winnipeg Regional Health Authority says that some patients may have to be sent to hospitals outside of the city for care due to the volume of people affected. Interesting to be mentioning strains and variants, sending people outside city for care. Stay tuned for this theme. It's reoccurring, as you folks may have remembered, as having lived through the pandemic of 2020 in your respective town. Now, I'm using Manitoba as a case study, but I encourage you to reflect on what you were told and who told it, and just trying to understand the narrative that was being pushed. And I think that you may find consistencies in your local community or neighborhood news outlet about these stories and the narrative there. I would love to know, actually, if anybody in another city can tell me how their hospitals were in January 2020. Did you have a bad flu season? So, of course, now we go some surgeries to be canceled at St. Boniface Hospital after influx of flu patients. Again, we have 3 flu strains happening in January of 2020. This is January 10th, 2020 from CBC News. Possibly rescheduled at other facilities. Now, January 14th, 2020, pair of young Manitobans ages 17 and 24 die from flu complications, the families say. The chief medical officer says deaths of otherwise healthy people are tragic, but not unheard of. So we had a 17-year-old and So very sad to see a 17-year-old and a 24-year-old woman have died in Manitoba from the flu, according to their respective families. They died Monday after suffering medical complications, went into cardiac arrest. Doctors have concluded that it was caused by the type A influenza, the cousin of one of the unfortunate people that passed away, said on Facebook. Meanwhile, an asthma sufferer was battling the flu since January 1st. She contracted a bacterial infection she was unable to recover from. Now, I want to bring our attention to down here. This little line here says that, as the quote from Brent Rusin, Manitoba's chief provincial public health officer, told CBC News, "We do see every year young, healthy people who do get the flu and have serious outcomes." Rusin said the province is seeing the spread of both type A and type B influenza, though influenza B has seen more often and at much higher levels than we normally see for this time of year. Oh, the deaths of Rubenthal and Joanne Enns have not been officially confirmed as flu-related by Manitoba health officials. Let's just see where am I at with my stuff. Kate, just got one more here. The flu season, which started in September, has seen one lab-confirmed flu-related death, the province says. This flu season, which started in September, has seen one lab-confirmed flu-related death. This is the same article from January 14th, 2020. The death was reported to Manitobans in early December. No information on the age or gender of the person was provided. During last year's flu season, 17 people died in Manitoba, a Manitoba health report says. Earlier this month, the Winnipeg Regional Health Authority activated overcapacity protocols and the regional flu plan in its hospitals because there is a sudden rise in patients visiting emergency, urgent care, and critical care departments. So that's the foundation. So the hospitals are overwhelmed. Things are stressful in Manitoba in January 2020 before the pandemic started. Now, January 23, 2020, we're going to go into this article from CBC Health Explains. The headline is, do I have COVID-19, the flu, or a cold? So from January 14th to January 23rd, do I have COVID-19, the flu, or the cold, or a cold? If you feel sick, when should you get tested? There's some information about asymptomatic carriers. Yada, yada. Common symptoms in children do include sore throat, diarrhea, runny or stuffy nose. What are the symptoms? Unfortunately, this made me laugh. What are the symptoms? Unfortunately, the initial symptoms of COVID-19 are very similar to the seasonal flu and even the common cold. So you may not know whether you are infected with COVID-19. So let's just remember about the tests. I'm not going to repeat everything that I've already explained, but please make sure you understand the tests, because you may not have known whether you were infected with COVID-19, whether it was the flu, cold, or SARS-CoV-2, which causes the disease of COVID-19. So the symptoms can include fever, cough, difficulty breathing, digestive symptoms such as diarrhea or pneumonia in both lungs, which would be seen on an X-ray. And then also they were telling us that from a small study published in the American Journal of Gastroenterology, so in the American Journal of Gastroenterology, sorry, and thank you for your patience with me pronouncing that word, they found that the digestive symptoms are common, occurring as the chief complaint in nearly half of patients in COVID-19 patients. Now, how do they determine if someone has COVID-19? Well, they probably used a test. So the American Academy of Otolaryngology has proposed adding anosmia, or loss of the smell, to the list of screening tools for COVID-19 in the absence of other respiratory illnesses such as allergies. So if you didn't have any of these symptoms, but you didn't have a good sense of smell, you might have had COVID-19. Again, not everyone will be present with symptoms, so you can test positive for it, you can have it, but you won't actually show any signs of it or even feel sick. As we see down here, the only way to confirm COVID-19 is with the lab test. Symptoms may appear as soon as 2 days after exposure or as long as 14 days after exposure. The flu boop boop will not protect you against COVID-19. And what should you do if you have symptoms? If you are under 50 years old and otherwise healthy, just stay home and take care of yourself. Definitely don't go to hospital, says Dr. Andrew Morris, an infectious disease specialist at Mount Sinai Hospital in Toronto. The hospital's like the worst place for anyone. This is a quote. I'm reading a quote from Dr. Andrew Morris, an infectious disease specialist at Mount Sinai Hospital in Toronto, from a CBC News article. The quote is, "The hospital's like the worst place for anyone, other than people who are really sick and who will need hospitalization. Just being infected with a viral infection is not a reason to go to hospital." Yeah, okay. Well, okay. So as this long article goes on, this is a 5-part article just to review the symptoms of the coronavirus, cold and the flu: fever, fatigue, cough, sneezing, aches and pains, running your stuffy nose, sore throat, diarrhea, headaches, shortness of breath. As mentioned earlier, some people will be completely asymptomatic and still come up positive. So using tests that can't tell you anything, we were told that you may not have any symptoms, but you may be sick and a threat to other people. Now, this is an interesting one because I'm just going to plant the seed for future presentations, is that COVID-19 is diagnosed through the respiratory samples are being processed by provincial labs. The labs may screen for other things first, such as the seasonal flu. The sample will only be sent to the National Microbiology Laboratory in Winnipeg, should further testing be required. Now, the National Microbiology Laboratory, I'm just going to give you a little sneak peek, actually, because for folks that may not know, and I'm really excited about doing this, is that I'm just going to look at this article from 2009. So the National Microbiology Laboratory in Winnipeg had a situation in 2009 where Conan Michael Yao pleaded guilty in Grand Forks, North Dakota courtroom to a charge of failure to present merchandise for inspection when he got caught trying to smuggle genetic material from the Ebola virus across the Manitoba, North Dakota border. And who was Conan Michael Yao? Well, he had initially been hired by the Public Health Agency of Canada to work as a PhD fellow at the Winnipeg facility. The agency said there was never a public health risk, insisting Yao did not have access to the highest level pathogens and only worked with non-infectious material. So he was sentenced to 17 days in jail and was fined $500, but received credit for time already served. Now, this is 2009. I will come back to this one because we're going to look into the Winnipeg Virology Lab and its relevance with all of it. So I'm pretty blessed to be in Winnipeg, where this is happening so close to home and it has such global ramifications, but my apologies. So I think I've been going for about, let me just check, about 25 minutes. Okay, let's see if I can continue going with the momentum. So flu cases in Manitoba. Okay, yep, gone through that. Coronavirus prevention. You know, the classic: wash your hands often with soap for at least 20 seconds, avoid touching your eyes, nose, mouth with unwashed hands, cough or sneeze with the crook of your elbow, avoid close contact with people who are sick, clean and disinfect frequently touched objects and surfaces, stay home when you are sick. I'm not going to touch on this one though, it's just asking, and part of this article, will a mask protect me from catching COVID-19? We do acknowledge though that early on in the outbreak, the Chief Public Health Officer, Teresa Tam, said that wearing a mask when you're well is not an effective measure. Not an effective measure for keeping yourself safe from infection. But the science advice has changed. She does. Okay, I said I won't go there, but she did say that wearing a mask could give people a false sense of security that could encourage wearers to relax physical distancing, she said. Okay, so the whole reason why I wanted to lay the foundation for the pandemic using the January 2020 in Manitoba as a case study is because on December 26, 2020, it was announced that Manitoba finds its first flu case of the season and a low incidence believed to be due to COVID-19 measures. Yeah, so we found the first flu case of the season, December 26, 2020, made the headlines. And just to be clear, January is the first month of the year. So January, February, March, April, May, June, July, August, September, October, November, December. December is the 12th month of the year of 2020. January is the first month of the year. So basically 12 months later, we find the first case of flu of the season. The headline, the article goes to say that Manitoba has found its first and only so far case of influenza this season. During this week of December 6th to December 12th, the province confirmed a single laboratory case of influenza, B. Manitoba Public Health declared on its website. In other years, it is common for the province to discover dozens of flu cases per week. Public health officials say they expected lower flu counts this season because of efforts taken to reduce the spread of COVID. At the outset of the COVID-19 pandemic, officials feared hospitals would be forced to contend with an influx of both COVID-19 patients and flu patients. As of Thursday, Manitoba hospitals are treating 346 COVID-19 patients and no flu patients. So I still feel like I am in somewhat of a temporal suspension hole, or whatever we want to call it, a pocket dimension, a pocket universe, because I'm really having trouble understanding how there are these articles from December 26, 2020, saying that we found the first flu case of the season confirmed from officials, whereas we also have the articles talking about 3 different flu strains in Manitoba in 2020, of January 2020, which as I'm counting that's the first month of the year of 2020, and December is the 12th month of the year of 2020. So we even had the people allegedly die from flu complications, but they were not lab confirmed. So, okay, yeah. So maybe I still can't read a calendar right. If somebody could maybe comment or send me a message to actually say that I'm insane, and I would be a little embarrassed if it turns out that I'm not counting the days of the months of the year correctly. But as I understand it, this is just what we were told. So just the side-by-side comparison, just so everybody knows. So we're going to review here is that the hospitals were overwhelmed in January 2020 due to the flu, lab confirmed flu cases, patients being flown out of province, surgeries canceled, staff shortages at hospitals, reducing ICU beds intentionally year to year. We have confirmed flu cases in January 2020. Meanwhile, December 2020, it was reported by health authorities the first flu case was detected of the year. So did the coronavirus literally erase the history of the flu in Manitoba? Were our measures so efficient that we were able to change the course of history? And I know that I said that I would try to be neutral and just as objective as I could be, but I apologize that I am maybe a little bit snarky with this, but I think that a lot of people reading this would be able to understand. So we're also going to just throw that in there, that the PCR tests used to tell us that somebody has SARS-CoV-2, aka COVID-19, were calibrated in Manitoba at a 40 cycle threshold, which makes the tests useless, according to Anthony Fauci. So this was, let's see, so 30 minutes, okay. Because it's been 30 minutes, then I am going to continue to get more into the actual cases. So I said to myself to go to 43. Okay, so now we're going to look at March 10th, 2020, the headline, What Manitobans Need to Know About COVID-19, reported by Aidan Geary. Again, March 10th, 2020, Manitoba reports its first COVID-19 case on March 12th. The article is from March 10th, but the subtitle says Manitoba reported first COVID-19 cases on March 12th. So I'm just seeing this now, but was this article posted before they found a case? That must be a typo somewhere. Maybe I've uncovered some more temporal paradoxes. So again, if people want to go verify it, I've got this link right here, and I don't know if I'll be providing the links below in the description. I haven't decided that yet. I probably should, but I mean, I'm taking just legit screenshots from the CBC articles and showing them here. So, Manitoba is under a state of emergency. The provincial officials announced March 12th they had identified Manitoba's first probable case of the illness caused by the coronavirus. On March 27th, the province announced its first COVID-19 related death. Maybe I've got some mix up here with this headline and the articles, but I'll try to sort that out. And it's weird to catch myself doing that while I'm recording it, but hey, I'm still new to this, so maybe it just shows you that I'm actually a real person. Presumptive case. Rusin said officials were notified of the first presumptive case Thursday morning. It was expected that Manitoba would eventually have a presumptive case, and processes were in place to rapidly identify it, naming those tests that we covered. Of course, stay away from people. Now we've got second and third presumptive cases of coronavirus identified in Manitoba. First presumptive case. Now it's very interesting, the term presumptive case. So we are presuming that you have it before we can confirm it in a lab. But even when it's confirmed in a lab, what is it really telling us? Because and again, we're showing here that National Microbiology Lab is where the tests are being confirmed. Telling you about getting tested. There were 403 completed tests on March 11th. Should I be worried? You should be responsible and informed. I'm going all the way to slide 50. Okay, how many confirmed cases? The Manitoba's healthcare system was expecting and prepared for the arrival of COVID-19. Rusin says that fear and panic will not help against COVID-19, but our preparedness and credible information will. So what is a presumptive case versus confirmed case? Things to reflect on, as it seems that presumptive case means that we don't, it's just speculated that you do have COVID-19, but then once it goes to the lab, then it is confirmed that you have it. So we have one patient hospitalized with COVID-19 in Manitoba, public health officials say, from March 19th, 2020. There are 19 known presumptive and confirmed cases of COVID-19 in Manitoba as of Thursday morning. Well, which is it? Is it presumptive or is it confirmed? I mean, this is 2 years ago, so doesn't, it doesn't really matter. Well, it actually does matter, which is why I'm doing this, because I think that these people and everything we were told, it needs to be, the accountability needs to be made, needs to be had. So just remember that there were no visitors allowed to acute care. So another change will impact who can visit loved ones in the hospital. So because of the tests and because of the cases, because of the fear of the healthcare system, they were not the Sira Gusa, who was and still is the chief nursing officer for Manitoba Shared Health. She said that visitors are no longer allowed at acute care sites across Manitoba. Exceptions include visitors to obstetrics, neonatal intensive care, pediatric care, or in an emergency or trauma situation. Place of worship should no longer be having big gatherings, he said, and people should not arrange play dates for children. From Brent Rusin. Interesting. So there's just some stuff about the cases Now we're going to go into hospitalizations, hospitalized with COVID and or from COVID. And I bring that up because we're going to be looking at an article that talks about Anthony Fauci from 12/31/21. So I'm reading this that it's December 31st, 2021. December is the 12th month of the year, and it's the 31st day of that month, December 31st, and the year is 2021. So the next day is going to be December 1st, 2022, which makes it seem like when we were looking at those articles about the flu, that my understanding of time in this paradigm is actually correct. But again, please correct me if I'm wrong. I don't really know what time is anyway. It's infinite, it's cyclical, whatever. It's hard to keep track of things in a linear fashion. So in this article by Ian Palmer, this is Dr. Anthony Fauci has downplayed concerns about a rise in the number of children in hospital with COVID as the Omicron variant continues its rapid spread. So speaking to Eamon Moyeldin, who is filling in for Rachel Maddow on Wednesday night, Fauci suggested that some of the children currently being treated at medical facilities were hospitalized with COVID as opposed to because of COVID. They were hospitalized with COVID as opposed to because of COVID. Interesting. He added that some children who are currently listed as being in hospital with COVID may actually be receiving treatment for a broken leg or appendicitis, rather than for a severe reaction to the virus. Okay. So I don't really know what to say. That is what Anthony Fauci is saying. You know, I don't know if YouTube is still censoring these kind of things. I know I'm saying a lot of buzzwords, a lot of trigger words that are probably getting flagged, but it is what it is. These are the articles. This is what's coming out. This is the information. I don't know what to tell you. Maybe if they take all of this down, then I will just make up more videos and use code words for everything. So Fauci, the White House chief medical advisor, also said that while the risk of children getting hospitalized with COVID is far lower than for adults and elderly people, the numbers would be expected to increase alongside the record-breaking number of new cases recorded in the US and the rest of the world due to the spread of Omicron. So he says that while the risk of children getting hospitalized with COVID is far lower than for adults and elderly people, the numbers would be expected to increase alongside the record-breaking number of new cases recorded in the US. Interesting. So that is the cases. I'm just looking at my notes. Okay. So to go from just do a recap, I think that this is all that I need to do for what I wanted to cover here with the PCR tests, the cases, and hospitalizations. I'm not necessarily giving you any answers. I am simply trying to present the information presented to us, the public, through corporate government outlets of information. So again, just to really hammer that home, the PCR tests themselves, not valid, can't be used, yet they were. The hospitalizations, so even being hospitalized with COVID, you could have gone to the hospital for a broken leg, take a test, and then test positive, and now all of a sudden you are a case. You are a hospitalized person with COVID-19. And you know what, because I still got a little more time, I wanted to keep this under an hour. I am gonna actually proceed on to the part of the hospitalization and the deaths of COVID-19. And this is just, I really am just trying to scratch the surface with all of this. It's not explicitly deep dives. sure we'll be going that into later presentations, or maybe even having guests on the show on this podcast with who can be explaining things in much greater detail. But let's see. So I have to go to page 71. So March 27th, 2020. This is our time to act, Chief Medical Officer says as Manitoba sees the first COVID-19 death. The death of Winnipeg woman in her 60s who was in intensive care is a tragic loss, says Dr. Brent Rusin. Health officials would not answer questions about whether the woman had any underlying medical conditions, citing privacy laws. Now, I'm continuing with talking about these slides because it's really hard for me to hold back when I know what is coming in the information I want to present. Because for anybody that's paying attention now, citing privacy laws as why the health officials would not answer questions about whether the woman had any underlying medical conditions. And of course, the province also announced Friday that it is ramping up measures to deal with the virus. That includes cracking down on public gatherings, which will be soon limited to 10 people. Now, keep that in mind as the Emergency Measures Act is trying to be implemented in Canada. And I'm just reviewing stuff from early on in the pandemic in Manitoba, a province of Canada, where part of the restrictions, which I will be getting to in the whole response, I think will probably be part of my fourth or fifth video in this series. So this article also goes on to say that they introduced 5 provincial border checkpoints. My apologies for the burp. 5 provincial border checkpoints where travelers will be informed about the risk of COVID-19 and the need for self-isolation. The need for self-isolation. Oof. And again, this statement here, I had privacy laws and underlying medical conditions. Anybody? Hello? Bueller? Hello? So this, okay, now this is really good actually. And when I was telling people about the research that I was accumulating, multiple folks had asked me if I had heard of this specific health official from the Illinois Department of Public Health, Gozi Ezeki. And I will show you why. So this is from May 11th, 2020. Why and how COVID-19 deaths are tracked in Illinois from WAND. We are Central Illinois. This is a local news outlet. It's not CBC. I went to go find some American news stories for this. So this is May 11th, 2020. Of course, 80,000 Americans died from COVID-19. 3,000 of those are from Illinois, but it is believed that the number is skewed. So on April 19th, Dr. Gozi Ezeki with the Illinois Department of Public Health answered a question about COVID-19 related deaths with underlying health conditions. The quote is, now please buckle up and listen carefully. This is the quote from the Illinois Department of Public Health. Technically, if you died of a clear alternate cause, but you had COVID-19 at the same time, it's still listed as a COVID death. Everyone who's listed as a COVID death doesn't mean that was the cause of death, but they had COVID at the time. So let that sink in. I get chills every time I read that, because throughout all of these articles that I found, this is one of those that were just kind of like a eureka to, kind of the bullshit meter, if you will. Dr. Ezeki's response was speculated as if the number of people who died from COVID-19 are exaggerated. Soon after, there was a notion that hospitals could get more money if it had more positive cases of the virus. On April 27th, Governor J.B. Pritzker addressed it, the rumor and said he's not heard of it. But he does say this: it may be something to do with the CARES Act, but that's not something that we're doing. So any of my American friends that end up watching this, the CARES Act, and were hospitals getting money for people that were marked as a COVID hospitalization, regardless of if it was with or from. However, as Anthony Fauci kindly explained to us, you may break your leg, go to a hospital, test positive for COVID, and now you are a COVID hospitalization. Now, that seems to be the same thing with deaths. It's the same consistent method. So here we go on. So Representative Darren Bailey sued the governor. So Darren Bailey told WAND News that the governor is not being factual. The quote from Bailey says, "You could be driving home and be in an auto accident and die from that. And if you had COVID-19 in your system, that death gets labeled as COVID." And how do they measure if you have COVID-19 in your system? Using the tests, which apparently were calibrated at 40 cycle thresholds, which conclusively don't show anything worth saying that you have a virus that you died from. And now let's look at Jim Allman, the Sangamon County coroner who signs death certificates, keeps track of the data. In the state of Illinois, there are two types of death certificates. And I know I'm using Illinois when this is specifically about Manitoba as a case study, but this is a global event. We got to look at all places all over the world. I just have been using Manitoba because that's close to my heart, because that's literally where my home is. And a lot of the audience that I'm trying to reach, a lot of Manitoban folks, but really international, American, anybody that watches Generation Z or all over the world. So first, the quote is, first, there is the coroner's medical examiner certificate that the coroner or medical examiner fill out. The other type of death certificate is the medical death certificate that a physician fills out. Allman said that COVID-19 related deaths are placed on a medical death certificate and the manner of death is natural. The coroner said an example would be if a person died from pneumonia, but they tested positive for the novel coronavirus. COVID-19 would be the contributing factor to a person's passing. COVID-19 would be the contributing factor to a person's passing. The CDC provided guidelines on how to record COVID-19 deaths. One method of verifying is to report the person's conditions that led up to their demise. Any information, including medical history and lab results, would be used to report the cause of death. Dr. Ezeki said that described the case definition as very simplistic. It means that at the time of death, it was COVID positive diagnosis. It was a COVID positive diagnosis at the time of death. Frankly, Allman told WAND News that the idea of padded death numbers is I didn't take the whole phrase there, but so again, I'm learning about all this. I will be revising my stuff as I go along, but bear with me. Thank you very much. So frankly, dying from a car crash with COVID-19 is not a COVID-related death, nor should it be labeled as one, Allman told WAND News. So we're going to continue on with that article. Maybe I put the missing information, but just to really hit this one home, the coroner's office that I've spoken to and the coroner's office of Sangamon County will not put COVID-19 as a contributing factor on somebody's death certificate if it did not contribute to their death. That's fair. The Illinois Department of Health sent WAND News a statement about COVID-19 related deaths. The number of COVID-19 deaths as IDPH reports represents individuals with laboratory confirmed COVID-19 at the time of death. IDPH also tracks those where the cause of death on the death certificate is listed as COVID-19. However, we are currently only reporting laboratory confirmed cases. If the death of someone who has laboratory confirmed COVID-19 is completely unrelated, e.g. car crash, fire, homicide, that death is not included in the case count. We do not have a breakdown of that number. We do not have a breakdown of that number. So the health department clarified all of this confusion here, saying that we currently only report lab confirmed cases, and if the death of someone who has a lab confirmed COVID-19 is completely unrelated, e.g. car crash, fire, homicide, that death is not included in the case count. So I'm just going to say that that is what they said. I can't confirm nor deny whether they are telling the truth. However, it's interesting that the individual in this article, the representative, Darren Bailey, who is a representative of Ray Kuntz, a member of the Christian County Board that sued the governor, claims that the governor was lying. Yes, so I did. Sure, we can go over this again, as I'm telling myself to, is that let's remember that if you died a clear alternate cause, but you had COVID-19 at the same time, it's still listed as a COVID-19, as a COVID death. Everyone who's listed as a COVID death doesn't mean that was the cause of death, but they had COVID at the time. So it's interesting that the Illinois Department of Health is contradicting what this spokesperson said, Dr. Ngozi Ezeki. So yeah, I think that that's pretty much all the information that I'm going to do today. Let's check. Yeah, that's about good. So did I do my own little wrap up? Well, yeah, might as well just say it, is that so remember that the test cannot show infectiousness, the test cannot detect transmissibility, the tests are useless. So just the question is, going back, how, okay, actually, let's do this in real time. So to finish up, let's just do recap of dose of reality number 2. PCR manipulation, we will say. We looked at January 2020 flu cases confirmed, December 2020 first flu case appears in Manitoba. I don't know how that happened, but it is the same Winnipeg Regional Health Authority who said that the flu cases did kill people in January, and then the same health authority said that the first flu case appeared. So that is just a little strange and inconsistent, if you don't mind me saying. Then we looked at the whole hospitalizations with and from COVID, as per Anthony Fauci. Deaths of COVID, as per Department of Illinois. You can test positive at time of death in a car crash, and it counts as a COVID death. And of course, that is America, that's not Canada, but we can imagine that there are the same protocols being followed all around the world, as we looked with Christian Drosten on his Wikipedia page, where it says he created the RT-PCR test, and they sent those kits to all the regions of the globe that were affected by COVID-19. So I think that about wraps it up for today. Did just under an hour. And I am going to stop the screen share here. So thank you very much. It's an honor and a blessing to have this platform to share my research. I am so grateful. My name is Riel. This is the second segment in a whole series that I plan that'll be chronicling the pandemic, specifically through the using Manitoba as a case study. Manitoba is a province in Canada. I am a researcher at Generation Z podcast. You can find our content there, hosted by Dave Zed, Generation Z podcast on YouTube, and you can find us at Generation Z podcast on Patreon, where it is a paid for subscription. And unfortunately, that's kind of the way that everybody's got to go right now if they want to talk about things that are being censored. And I recognize that the topics that I am presenting are very hot topic and controversial, but I'm trying to just help us unpack everything that's been going on. So yeah, please, they always say the whole thing, like, subscribe, etc. I am very, very happy about the response. Thank you so much. And I will see everybody again very soon. Thank you very much and have a great day.